It is Monday morning. You have 11 urgent prior authorizations that need same-day submission. An acute cardiac patient is waiting on an MRI clearance. The phones are ringing, and your intake coordinator just called in sick. That pressure is entirely measurable. According to the American Medical Association's 2026 survey, the average physician is now responsible for completing 40 prior authorization requests every single week. Take a look at this standard 40-hour workweek calendar. Managing those requests consumes 13 hours of physician and staff time. Nearly a day and a half vanishes into administrative paperwork with zero connection to patient care. The toll this takes is heavy. The same survey found that 94% of physicians report prior authorization actively contributes to their burnout. 32% report that these painstakingly assembled requests are frequently denied anyway. This manual system is an active threat to practice viability and physician well-being. The rules of the game have changed. As of January 1, 2026, the CMS 0057-F mandate is in operational effect. This timer visualizes the core requirement of that federal rule. Impacted payers must now issue an expedited prior authorization decision within exactly 72 hours of the request. The problem is when that clock starts. It begins the moment you submit the file. But manual teams suffer massive lag. An urgent request can sit in your intake queue for 6 hours before anyone opens it. Then you account for the after-hours math. If a physician places an urgent order at 8 p.m., an in-house team won't touch it until morning. You lose 12 critical hours to darkness. When staff try to rush the submission to make up for lost time, the quality of the work plummets. A Kaiser Family Foundation analysis found that 80.7% That means the manual, rushed submissions missed the mark the first time, triggering a denial that never should have happened. Standard practice queues are structurally incompatible with these federal timelines. They all but guarantee a failed submission before a payer even opens the file. To solve the math problem, over 800 practices moved to Staffingly. They deploy an outsourced 24/7 hybrid service, combining AI automation with credentialed human specialists. This infrastructure ensures urgent prior authorizations are submitted within exactly 60 minutes of the order being placed, around the clock, every day of the week. It is important to define the role of the technology here. The AI does not make clinical decisions. It is designed solely to handle the roughly 80% of repetitive administrative keystrokes required to build the file. Staffingly operates as a compression engine, taking a chaotic, multi-day manual effort and condensing it into a 1-hour submission window. Here is a flowchart of the 60-minute turnaround. An AWS Bedrock AI agent monitors your EMR, identifying urgent orders instantly without staff triggers. The AI extracts supporting labs and drafts the medical necessity narrative with precise citations matching the payer's policy. Then the human safety met engages. An AAPC-credentialed prior authorization specialist steps in to manage the final 20%. They review the clinical reasoning, apply their specialized judgment, and route the packet to the correct expedited payer portal. The system continues to work after submission. It tracks the 72-hour CMS window, and if a peer-to-peer review is required, it automatically preps the ordering physician with a concise chart brief 30 minutes before the call. Pairing the immediate scale of AI with precise human clinical expertise allows practices to consistently submit accurate files well before the federal clock threatens them. Fixing the operational delay is only half the equation. The other half is protecting the financial health of the clinic from massive overhead costs. This chart exposes the financial burden. A fully loaded in-house coordinator costs up to $84,000 a year. Urgent queues require constant coverage, forcing practices to hire two. Compare that to Staffingly's solution, 24/7 coverage for just $299 per week. Moving the urgent prior authorization queue out of the back office eliminates the need to overhire, allowing practices to reclaim lost profit margins. The ultimate return on this efficiency is clinical focus. Physicians spend their hours looking at patients, completely relieved of the administrative dread and the constant interruptions of peer-to-peer ambushes. Staffingly operates directly inside your existing EMR, whether that is Epic, Athena, or eClinicalWorks, and goes live in 5 to 10 days. You can start a 2-week risk-free pilot covering your urgent queue by visiting staffingly.com/demo or calling 800-489-5877. The CMS mandate set a timer that manual workflows cannot beat. It is time to upgrade to a system built for the actual speed of modern medicine.